Welcome. Hi. This interview is going to be with my brother, Satcher Jr., MD, Ph.D., and he's a retired astronaut. He participated in the STS-129 mission to the space station, and he did his residency at UCSF, did a fellowship in orthopedic musculoskeletal oncology at the University of Florida in Gainesville. Welcome.
Thank you.
So what I'd like to do is just ask you a few questions. First, tell me what you do at your hospital.
I'm a orthopedic oncologist, which is a orthopedic surgeon that takes care of cancer patients. So if there's disease that starts anywhere in the musculoskeletal system, or if there's metastatic disease from somewhere else that goes to the skeleton, I'm one of the people that takes care of patients like that. And that usually involves, some sort of surgical procedure to either remove a tumor or stabilize bone.
I've been interviewing colleagues and people that I know about subjects that have to do with the coronavirus. And particularly, I'm interested in what recommendations doctors and others have for people that are trying to prevent or, stay away from getting the COVID virus. And particularly people of color, because I feel that we're at an increased risk for the COVID virus. So, and I've heard that recently you got a new assignment dealing with the telemedicine during the COVID pandemic. Can you tell me a little bit about that?
That's correct. Yeah, our hospital wanted to start using video conferencing and telemedicine, and it's something that I've been involved with for a few years. My interest goes back to when I was at NASA, because we used telemedicine to take care of astronauts. When I flew on my mission, I was the crew doctor for our crew. And the way that we take care of astronauts when they're on orbit is using telemedicine. Basically, it's talking with doctors on the ground for whatever issue needs to be addressed, and then implementing it on orbit with the astronauts, with the crew doctor being the astronaut who's responsible for the rest. I basically got involved with that over the last 2 years or so, and with the COVID pandemic, as you know, all the hospitals are more interested in using telemedicine and video conferencing. So I've been involved with that, trying to implement that at our hospital.
What kind of volume were you getting or were you seeing in the telemedicine realm at your hospital before the pandemic?
Well, we weren't using it before the pandemic. So yeah, we were studying using it, and there's a lot of hospitals like that who, because of the government and billing specifications, we're just sort of going slowly looking at using telemedicine, but hadn't implemented it yet. So with the COVID pandemic, the government moved quickly in terms of implementing a lot of the billing codes. And so they also changed the laws so that doctors could practice telemedicine across state lines. And because of that, all the hospitals moved forward with it. So it's been a very exciting time from that perspective, because a lot of people who were sort of sitting on the sidelines have decided to get into it.
What I was going to say is that at the VA, we had already been using telemedicine and we were going across state lines. So I guess they just decided to move it over to the public sector. because they've already been looking at it at the VA. And I think also at the Department of Defense. So they're
That's
announcing,
correct.
yeah, they're announcing today that the peak on the East Coast anyways is expected in the next 2 weeks. Is the vulnerability at the local level, or is it at the national level as far as like internet capabilities?
I think for reaching patients who are in their homes, it certainly will be a challenge because there's a large degree of variability in people's access, and especially with poor folks, people of not as many means, the internet access is not as good, not as reliable, and a lot of times the only access they have is through their smartphone. So it has to be focused on using smartphones because of that if we are going to try to reach as many people as possible. And I think most hospitals are, in fact, using that strategy. But then, of course, it relies on the network, which supports smartphones. And that has a certain amount of volume it can handle before things really get slow. If you've ever been to like a stadium during a concert or during a game, you know that it can be challenging trying to send anything more than a text message. So this is something which certainly is going to be an issue.
Yeah, what I had said is that at the VA, we've been using telemedicine before this, and we were allowed to go across state lines, and it really wasn't really a problem, and we were actually starting to step up our volume before the pandemic. However, since the pandemic, like I have a laptop, and I haven't been able to get onto the system at all, and getting on the system is really spotty. And not everyone is issued a cell phone. Some people have cell phones from the VA, but not all. But they are equipped, which is, so it's good that the government decided to move over to the public sector the same privileges that the DoD and the VA have. So regarding, I know not all of your patients are people of color, but I know you have a proportion of patients that are people of color. And, we have social determinants of health that make us more at risk for things that are predisposing for the COVID virus, like hypertension, diabetes. Your patients are immunocompromised. So how are you advising your patients, and particularly those of color, about avoiding getting sick?
Well, it's the same precautions that are widely put out: lots of hand washing, and maintaining, social distancing, isolating oneself, especially if you are immunocompromised. Because as you indicated, predisposing factors like that make the your risk of succumbing to coronavirus much higher. Most of the deaths are with people who have predisposing factors. So the whole trick is just making sure that you minimize your risk. And even if you get exposed to it, you still might not, contract the full syndrome or disease if you, are frequently washing your hands, because, it's thought that the transmission is mostly by contact. So getting it on your hands, touching your hands to your face, it's thought that that's the primary mode of transmission. So it's really important to wash your hands, and minimize your exposure to other people who may have, coronavirus, but not be manifesting symptoms, but are in fact able to transmit the disease.
If your patients were to get symptoms or to have a positive test, what should they do if the facility sends them back home?
So after they've been in the hospital, they get sent home and they have the disease. Well, they have call-in lines 24/7 where they can call in and say that, they think they have symptoms, and they'll be able to speak to a practitioner, either a nurse or a medical professional who will basically take their history, decide on whether or not they need to go get tested, or whether or not it's some other issue. So, and MD Anderson and other hospitals too have increased the availability of testing for their patient populations, and so the availability of testing is there. So it's as you know, it's a kind of a rapidly evolving situation, but I think with each day, more and more resources are being brought appropriately to bear on it. With people of color, I always try to encourage them to basically use the resources that are available. Obviously, people of color have a understandably complicated relationship with the medical community, just because there have been a lot of things to make it such that people of color don't trust the medical community, very logically don't trust the medical community. So I try to, speak to that and let them know, look, this is something which affects us just as well as everybody else. And you need to make use of the resources, just call in, let it be known what you're going through so that the appropriate decisions can be made.
One last thing, just quickly. I know that most hospitals are canceling elective procedures. I just found out from a mutual friend that somebody that was supposed to have a kidney transplant, that some of the hospitals in Virginia were saying they were canceling those too. Are you all canceling? Because here, I think I've heard that they're still doing surgeries, like if it's cancer related, like if they were supposed to get a mass out or something like that. What is your hospital doing, and what have you heard?
Yeah, our hospital is doing surgeries that are directly related to cancer. And so if somebody has a tumor that needs to be removed surgically, we're doing that. The other surgeries are when people have metastatic disease that's spread from a cancer to somewhere else in the body, but it's causing a severe impact, then we're doing those surgeries too. Now, I think what people don't completely understand is why we've shifted to doing that. The big resource, which is scarce ultimately, is ICU and ventilator resources. And patients who are having surgeries are more likely to need ICU and ventilator resources. And sometimes it's not very predictable which surgery patients are going to need that. We have a lot of patients who have elective surgeries who actually need it. And so an elective surgery, just by definition, is one that you can delay and put off for, safely for some period of time. And so just given the constraint in resources, that's the strategy that has to be used, so that if we have a lot of patients coming in with, coronavirus, COVID, that need to be on a ventilator, there's as many ventilators available as possible.
Okay, well, we learned a lot from you today, and I would just like to reiterate what you said in the beginning about telemedicine, because I think that's a really important part of the interview, that you said that people may be able to better connect using their cell phones than using like a PC or a laptop. And I think I've seen some of that myself, with just using some of the telemedicine platforms, that it does seem to be working better on the phone,
Mm-hmm.
for the patients and for me. So, so
Yeah.
did you have any questions for me or any other comments that you wanted to make?
Oh, but thanks for doing this project. I think it's good to get the information out, especially in communities of color, which don't receive a lot of direct attention a lot of times. So I think this is something that's needed, and just want to say thanks for doing it.
Well, thank you. Thank you for joining me on such short notice also.